Hi, good morning or evening, depending on where in the veterinary dermatology world you're viewing or listening from. My name is Rusty Muse, and I'm the secretary of the Ninth World Congress of Veterinary Dermatology. And on behalf of the entire executive organizing committee, welcome to another Q&A webinar for WCVD9. We hope you've enjoyed our Q&A sessions, which have been presented each week on Monday, and those have featured one of our esteemed presenters of continuing education sessions from WCVD9. And today is no exception, and we are fortunate to have one of the most popular and informative speakers with us today. The session today is designed around allergy and immunology, so please feel free to submit your questions in the question box on the Zoom link, and we'll get to as many of those questions as possible in the allotted time. Our first session today features Professor Doug DeBoer. Dr. DeBoer graduated from the University of California, Davis in 1981 and completed his postgraduate training at Michigan State University and at UC Davis. He became a diplomat of the ACVD in 1987, and the year before he joined the faculty at the University of Wisconsin School of Veterinary Medicine, where he's currently the professor of dermatology. Dr. DeBoer teaches foundation principles of clinical dermatology to veterinary students and lectures frequently in postgraduate continuing ed courses around the world. His research and clinical interests center on immunology of recurrent and chronic skin disease with a focus on canine allergic skin disease and feline dermatophytosis. He's received the ACVD Award of Excellence for contributions to science and education, and Dr. DeBoer has also served on the scientific and editorial boards of the American Journal of Veterinary Research and Veterinary Dermatology, and has served as chair of the International Committee on Atopic Diseases of Animals. On a personal note, I have to say that Dr. DeBoer is in fact a role model to me from when I started my veterinary dermatology career. And so I'm really pleased to be able to talk with you today. So welcome, Dr. DeBoer, to our webinar. And so how are you doing this afternoon?
I'm doing very well, Rusty. Thanks very much. And it's great to be here and to be joining the WCVD9 live.
Yeah, that's great. So this World Congress has been certainly different than the ones that have been delivered to date, thanks to COVID-19. And I hope that you and your friends and family are all well. So what has your experience been so far with the virtual Congress?
Well, I think maybe the word I would use to describe it is overwhelming. Honestly, it's we started out a group of us saying, well, we're going to watch things together, and we sort of figured out if we watched things together 2 or 3 hours per week that it would take us more than 6 months to watch everything. So I think it's great that we can have the opportunity to see so many things. And of course, in in a live meeting, it's always better because you get to interact with people. But the upside is that you can listen to everything you want to in the virtual format.
Yeah, exactly. That's one of the nice things about it. There's so much in a live conference that you miss that you don't get to see, but on this
Yes.
format, you can actually see it all. So that's awesome. So, Doug, you've been an integral part of veterinary dermatology for a while, and you've seen many changes in our field in terms of allergy management and immunotherapy. And, with all the new options for symptomatic control of allergies that are available to practitioners, I guess I'm interested in what your thoughts on allergen-specific immunotherapy and its continuing role in really managing or assisting in managing allergic skin disease. And so what are your thoughts on the state of the state?
Yeah, I think that's a great question. And in fact, it's one that I like to ask people myself. I like to ask general practitioners and my colleague dermatologists about that. How has the advent of some of these great new medical and biological treatments changed your practice, and how has it changed your approach to immunotherapy? Has it, is immunotherapy in fact something that's outdated? Is it something that's has been surpassed by other things? And I think it depends on your point of view, and I think it depends on the client. But I think all in all, my view, which I think is the consensus view, is it is still something that we should think about having in our practice and offering to clients as an option, because it has some unique advantages compared with some of the other options. And so I think it is still an arrow in our quiver that we shouldn't discard. But I also think it's very compatible with these new therapies. So I think there's definitely still a place for allergen immunotherapy.
Yeah, and I think that's a good answer because I think you're exactly right. It's all about assisting clients in making the right decision for those individual pets and using those things in conjunction with each other as well.
Yes.
So when you talked about some of the unique advantages, I mean, what would some of those unique advantages over symptomatic therapy be?
Well, as we know, allergen immunotherapy is pretty much, it's the only treatment we have that is quote unquote disease modifying. In other words, it's the only treatment that we have that actually works against at least part of the pathogenesis of the disease. So that is unique. None of the other medical or biological treatments actually work at reversing the changes, the immunologic changes that might be present in the patient, whereas immunotherapy does. So it has a very unique role from that standpoint.
Yeah, and just to clarify for any of our listeners out there, I mean, in your opinion, there's no contraindication to combining all of those therapies in patients either.
Absolutely not. In fact, I think that's the usual thing. I think that's what we all do or should be doing. I think the way that I often explain it to clients is that this is atopic dermatitis is a lifelong disease. Your dog is going to have this for at least a very long time, if not his whole life. And so we have to have a short-term plan and a long-term plan. The short-term plan is pretty much always to provide some kind of treatment, biological or medical treatment, to stop the itch as soon as possible, to give him some relief and use some relief. And but we also have to consider what is going to be the long-term plan. Is it going to be okay with you that your dog has to take this medication or receive this biological treatment at intervals throughout the remainder of his life? Is that going to be okay? If not, if you'd like to take an alternate approach, we can combine the short-term plan of using a medical or biological anti-itch, anti-inflammatory treatment along with an immunomodulatory or a disease-modifying treatment like immunotherapy, because in the long-term plan, we'd ideally like to avoid as much medication as possible. I like Rusty, our colleague, Valerie Fadok. I'll attribute this to her because it's one of the things that I heard her say once that recently that I really like, which is that allergen immunotherapy is an investment in your dog's future. So it's not something that's going to work immediately. For that, we have some great other treatments, but we can invest in the possibility of reversing these immunologic changes over the long term in the future.
Yeah, I mean, I think that's a great way to present that to your clients. I mean, the whole short-term plan, long-term plan, and I use that myself. I just think that's a great way for clients to understand how these kind of therapies fit together and how they can be utilized together. And I think for our listeners, that's a really good way to present to clients how to use.
Well, you must have gotten that from me, Rusty.
It clearly, that's exactly
yes.
right.
Yes, we have great ideas. Yes.
So, Doug, you mentioned one of the things about talking about long-term and Valerie's comment about making this an investment in your dog's future. What do you talk to people about? Because I think this is an interesting topic about how do you counsel patients as far as how long do you utilize allergen-specific immunotherapy in them before you kind of determine whether you're having success or failure?
I suspect I'm somewhat of an outlier on that question. I think if you would ask 10 different dermatologists, you might get 11 different answers, actually,
right.
because everyone has their own favorite answer to that. I err on this. So honestly, I believe, in my experience, I think if allergen immunotherapy is going to work, I almost always see at least partial relief by 6 months. Okay, I don't think it happens very often that there's no response at all at 6 months, and then all of a sudden at 9 months, things start to get better. So I know some of my colleagues would say, "Oh no, you have to use it for a year before you can say anything." I think a year is a long time for many clients, and I think saying so. What I say to an owner is, if you're going to try this, I'd really like you to stick with it for 6 months. Okay, and I'd like to see if there is any improvement at all at 6 months. Then we're going to continue it. But if you would just stick with me for 6 months on this, and then at the end of 6 months, if you really, really are convinced there's been absolutely no improvement and it's a hassle for you to give the injections or whatever else, then you can stop it. So I'm kind of the short answer, I guess, to your question from me is kind of 6 months-ish, and I'd be interested to know what you tell your clients.
Oh, well, this isn't about me, but I'm happy to answer that question.
I would like to hear your answer.
I might be on the opposite end of that spectrum. I started listening to a lot of my clients who came in who said, gosh, I've been on allergy immunotherapy, and it took me 2 or 3 years before I started seeing improvement. And I kind of listened to client after client after client tell me that in their human experience. And I thought, you know what, maybe we've really been selling these patients short, because I know, historically, I think when I was trained, I kind of said, okay, a year. And now I tell my clients, I'm going to want you on this for a few years. We can control your symptoms with any number of therapies, but I don't want to give up on immunotherapy. So I probably go much longer. And if I can get people to stick with it, I just have them keep doing it.
Yeah.
And I agree with you. I'm not quite sure that you see no response and then great response, but I think there are patients that get more just sort of gradual improvement and things improve over time. So that's my contribution. So
yeah, and I think actually our answers might not be that much different, because I think that we're both saying the same thing, which is it is gradual. I just for our clients, I think sometimes they have if you tell them this is something that's going to take 3 years right from the outset, they tend to be a bit discouraged by it, by cost and so much and so forth. But if I tell them we're going to start with 6 months and we're going to see how it goes. And to be honest, even placebo effect, I think, if you're getting even placebo effect at 6 months and the owner says, yeah, I think he is a little better, I think most owners will elect to continue past that 6 months. So I'm not saying that, you get full response at 6 months, but I think if an owner is really complaining that it's not working out for them, then I'm okay if they've tried it for 6 months.
Sure. So how do you gauge success? I mean, I guess success is different for different people and different practitioners, but how do you talk to clients and counsel them about, we are seeing some benefit, we're seeing great benefit. So how do you gauge success?
Well, I think you're right. And especially if there is success, how do you attribute that success to the allergen immunotherapy versus all of the other things you're doing? And most of which are providing kind of a general unwinding of the entire process, right? So how do you know if you're a year down the line and their dog is doing a lot better? How do you know? Is it due to the infection control? Is it due to the parasite control? Is it due to the fact that the dog has some kind of component of food sensitivity and that's being controlled? Or is it the immunotherapy, or what exactly is it? So I think it's very difficult to tell that. I think most of the time we just fall back on how much medication, other than the immunotherapy, are you having to use? Have we been able to back off on that substantially? Have we been able to, for example, if your dog is being treated with Lokivetimab, is your dog needing only one injection every 6 or 8 or 10 or 12 weeks instead of every 4 weeks like it used to be? Or maybe he doesn't need it all, or maybe he only needs it seasonally. So it's other medication use. And then we also just kind of fall back on what is your dog's current level of itch on a 0 to 10 scale. Overall, in the last month, how itchy has your dog been? and we look back at what they said initially when they first came in, and then over time. So I don't know. Again, I think it's a really difficult thing to judge,
Mhm.
but looking at additional medication that's been necessary, I think, and I also, honestly, I believe that owners, most of our owners, they have a pretty good feeling. They have a pretty good feeling for what's working. Most of them have been through this for so long with their dog
Mhm.
that if I simply say, well, what do you think? Do you think the shots are helping? Do you think they're working? What do you think is it that's working? And often they'll say, I just think it's everything together.
Mhm.
Everything together. He's better than he's ever been. I'm not quite sure what it is. I think it's a combination of everything together, which I actually agree with. It probably
Mhm.
is.
Mhm.
And so I'm like, great, let's keep going.
Right. Yeah, and I think that's a good point. Managing pyoderma is a big part of that. And I agree with you. I ask clients overall, are we just better than where we were
Right.
when we started? And the answer to that hopefully is generally going to be yes. But it's a good. Well, we've talked about dogs. I guess I'm interested in your input. I'm a cat guy, and do you use allergen-specific immunotherapy differently in cats, more or less? Any specific hints that you've got to allow our feline practitioners to get some additional insight?
I don't think that we do immunotherapy in cats in general any differently than we do it in dogs. We have a lot less experience in cats. I wish we had more, actually, but we just
Mm.
don't have that many cats as patients. Um, I guess two things. Number one, I started out thinking that something like sublingual immunotherapy was going to be absolutely not feasible in a cat. I sort of thought, what cat in his right mind is going to allow the owner to give that oral treatment so frequently? And I think that was wrong. I think some cats do take very, very readily to sublingual. Um, Having said that, I think that many times in cats, they're so easy to inject. Many owners do prefer uh, injectable immunotherapy, but there's that. And then I I've heard other people say this before as well, and I believe it, which is that I think in dogs we see everything from tremendous response to moderate response to mild response to no response at all. There's a real gradation. It seems to me that, and be interested to hear your thoughts, that cats either do really well or not well at all. It's almost kind of a binary thing, kind of a black and white thing, and there's less gradation in response with a cat,
Mm.
which I find really interesting from an immunologic standpoint. But I don't know, what do you think? You're the cat guy.
Yeah, yeah. Well, I guess I've never really thought about that particularly. I think that in my own personal experience, and especially living in a temperate climate here in California, so many other things confuse the issue with cats. I actually find when I practice in our Long Beach office, flea control in cats is difficult, and especially if you have outdoor cats. I think standard flea treatment, I end up doing combination flea treatment with most of my outdoor cats. They need oral and topical to be able to manage those. So I think a lot of cats get grouped into failures that really have nothing to do with the atopic component to it or the allergy vaccine. I think it's really, not controlling those, not identifying food, doing food trials in cats, is more challenging and more limited options. So I think we sometimes don't diagnose them as well, is one of my personal opinions. But, again, not quite sure there's value in that necessarily.
Yeah, yeah.
So I guess, we brought up a little bit about sublingual immunotherapy with cats. So what are your experiences and thoughts on just those two different forms of allergen immunotherapy? And based on the literature, are there differences in success rates, and do you think that that's the case in your experience?
Yeah, boy, I wish we could look to the literature for definitive answers on that, but unfortunately we can't. The total number of studies of of response to immunotherapy in by either sublingual or by injection is very low, and very low to begin with. And then if you're talking about studies that compare response of different types, there's only one that I know about, and it was fairly recent, and it concluded that maybe injections are better. But the problem there is whenever you're looking at any of these studies, you always have to say, was it the same product that was used? What was the specific product that was used? Is it possible that the reason worked better than another had to do with the extracts themselves, okay, as opposed to the protocol or the frequency or something else, some other attribute other than merely whether it was given sublingually or by injection. So I guess, speaking, if somebody says, well, what's the truth according to the literature, you have to say, well, we really don't know yet, and probably actually won't, unfortunately, because these studies are so difficult to do. I think what's actually more important when I talk with clients is what can you do? What can you be compliant with? If an owner says, well, what's better? The oral route or the injection route, I'm on the fence. I say, well, what's easiest for you to do? Because honestly, I have come to believe that sometimes the reason why injection immunotherapy has failed in the past is strictly owner compliance. And owners, even though they say they don't mind giving injections, most of the time they don't like it. And I think there's with both types of immunotherapy, there's a lot of missed doses probably. And obviously the thing that works the best is maybe one of the things that's most predictable with success is the thing that the client will administer faithfully. And if their lifestyle is such that they can't administer a sublingual formulation twice a day routinely, faithfully, well, then it's not going to be good for them. So in choosing between the two methods, what my focus is with the client is, what can you do? What is realistic for you to be compliant with? Because this is going to be a long haul, and we want to make it easy for you and not unpleasant for your dog or cat. And so, again, that's my answer.
Yeah, and I think that's a great answer, because it really is. It's all about client compliance, and so I agree with you. That's pretty much my approach as well. Is just saying what is it going to, what fits into your lifestyle, what can you do, and how does it work for you? Absolutely. It's So, we talked about immunotherapy, and I guess one of the questions, if clients that talk to you about risks and side effects, how often do you see those adverse issues with immunotherapy, and how do you handle those?
I'll have to say, I guess I should knock on wood when I say almost never, but I guess that would be my answer. I think almost never, and the even anaphylaxis. Even anaphylaxis from injections, I think is the literature says maybe something about 1%, and I think I'd maybe agree with that often, which is maybe 5% to 10%, something like that, is transient worsening following dosing. Okay, the dog or cat that gets worse, either scratches at the injection site or rubs the face or whatever, or transiently gets more itchy after the dosing. I think that happens to some animals with some regularity. And honestly, if I see that, I actually feel good about it, because I think it's an indication you are making an immunologic change, right? You're having an effect. And so whether or not we elect to back off on the dosing or not kind of is an individual decision based upon how severe the reaction is and the owner's tolerance and so forth. But
And so, as far as induction immunotherapy, with your experience, I know different dermatologists do it differently. Some start off with like a tenfold dilution, others go down to a hundredfold dilution. How do you start your induction immunotherapy? Do you have a preference?
Um, we still pretty much do what I think is the party line, maybe, which is a hundredfold dilution of the final concentration.
Mhm.
I think that's mostly for probably not any good reason other than maybe just history, and
Mhm.
maybe it's because it's always what we've done. I think the reason why we start, the reason why we all of us start or have been taught to start with a lower concentration is because of the possibility of there being some kind of either localized or anaphylactic reaction. And we
Mhm.
want to catch that early before it happens.
Mhm.
So I know there are dermatologists that actually start up at the higher concentrations, even sometimes at the maintenance concentration, and don't have that escalation.
Mhm.
That worries me a little bit. And then on the one hand, you get a faster escalation up to the full dose, but I think you are taking a little bit of a chance uh, of there being a reaction that you're not going to catch.
Mhm. I will tell you, we actually start with a tenfold dilution and start our
So you just kind of
induction.
split the difference. Yeah.
Yeah, and so I don't find too many reactions, but on the patients that do start those reactions, I will then further dilute it to a hundredfold and
Yeah,
start over.
exactly.
Yeah,
Yeah,
yeah. So
I think
I
that's a great approach.
I actually
Maybe
had
I'll
one of
have to
those two
start
week.
doing that too.
Yeah, I had one of those 2 weeks ago, actually. So,
Okay, there you are.
so I do have we do have a mail-in question from Brazil, and they wanted to know, since we're talking about side effects, what's your opinion about the use of allergen-specific immunotherapy in allergic dogs with concomitant autoimmune disorders like lupus, pemphigus, other types of immune disease? Are there concerns that you're aware about, or does that change your approach?
Poor dog. Uh, that's what you call really unlucky.
Yeah.
If you're unlucky enough to have two severe diseases like that at the same time. To my knowledge, there aren't any contraindications to doing immunotherapy in a patient that has, for example, an autoimmune disease. To my knowledge, I'm actually trying to rack my brain to see if to think if I've ever done that. I think sometimes we'll have dogs that have something like maybe they're atopic and then they also have discoid lupus,
Right.
and those dogs we're not concerned about. Starting allergen immunotherapy in the face of that. So I guess my short answer to your question, to the question from the audience, would be no, I'm not concerned about anything bad happening
Yeah.
with
I mean,
concurrent
I guess the
autoimmunity.
question that's come up that I've dealt with are dogs with like autoimmune hemolytic anemia who have had a
Yes.
history of that as well. So I guess is that's kind of falls into those same categories of those various immune mediated disorders, and is there a
Right.
concern there? So it's, yeah, very good. Well, I guess sort of as we finish up, we've got to get here to the 30 minutes. I mean, are there any new kind of therapies or approaches regarding immunotherapy on the horizon that you're, particularly interested in or excited about, or you might be able to share?
Well, I think if we look to what's been being done in people, I think there are a number of things that are potentially extremely exciting. I think the question though is whether or not those will ever be feasible in veterinary medicine. Obviously, probably one of the ones that's maybe going to be used more in the next few years, maybe is interlymphatic immunotherapy, which we have not used yet, but clearly seems the studies seem to demonstrate that it is can be potentially of great benefit and work very quickly. So I think that's in both dogs and in people. So there's that. There are a lot of new technological things from the standpoint that are being investigated in people. For example, different adjuvants, the peptide immunotherapies that are being studied for
Mhm.
things like allergy to cats and that sort of thing. So there are a number of technological things that have an enormous promise for people The problem with those is it's just it's unlikely that we'll ever benefit from those in veterinary medicine for a long time, just because of the if ever, just because of the development costs and so forth, and the fact that some things like peptide immunotherapy are reasonably likely to be different in a dog than a person. So, but I'm excited about the possibility of intralymphatic.
Mm. Yeah, exactly. And again, I agree. We've had limited experience with that too, but I agree with you. It's an exciting based on some of the limited reports and literature that's out there on it. It definitely is something that I think perhaps at the next World Congress there might be even additional information that may change the way
Perhaps.
we're doing things. So it's a Doug, thank you so much for your time and expertise in joining it. And again, thank you for your participation with WCVD9. It's been really interesting listening to your lectures as always. And it's been great talking to you today. And so for the delegates, again, if you enjoyed this question and answer, please watch for additional sessions from our illustrious WCVD9 speakers advertised online on the WCVD9 website or with the e-zine that you receive by email. And join us either live on Zoom or catch us on Facebook Live. So these sessions are scheduled at different times around the world to allow for all of our delegates to attend these at a time that's convenient for you. So again, enjoy your week, and we hope to see you next Monday.